Well, I'm the medical director for the Sacramento County Medically Indigent Services Program. And in that role, I approve or deny services for non-emergency services for indigents who need medical care if they're eligible for our program. Well, Sacramento, you can see the need if you drive around the city and you see the homeless and you see the sad situation that a lot of our people have. And after a career of some 30 years of seeing patients one-on-one, I just felt like it was time in my career to try to help groups of patients and kind of in mass. And this indigent population was seemingly the most needy group in this community that needed my services. Again, my role was to approve or deny services to people who were eligible for our program. And case management nurses in our process would bring cases to my attention and say that they were an illegal alien that was seeking care. And so I learned over time that illegal aliens were getting care from our county. As a matter of fact, I really didn't know what an illegal alien was when I first heard that term. My take on the program was that we had this mandate to take whoever was indigent into our program and take care of them. But as our budget was facing a crisis in early 2002, they were going to be cutting staff at the clinics, the doctors there and the nurses. They were going to cut services to our citizens and the people I was there to serve. And we were having what we call scope of services meetings to determine whether or not we could, what we were going to have to do in order to survive the budget cuts. It wasn't the amount that bothered me as much as it was why were we serving a population that was illegal in our country with any funds that we had if we were going to have to cut our staff or our services to our citizens. And so I started checking into the mandate issues, whether or not we were actually mandated by law or whatever to supply medical services to the undocumented aliens. I reached some other counties, San Diego being one of them, and I was told that they did not have that mandate, that they had decided that they would not serve the undocumented for non-emergency care services. Well, I learned, and I asked our informational technology people to just, well, how much money are we spending on this group? Because I knew that we were spending money, and I could see it on our screens, but I didn't have any idea how much that was. So the informational technology personnel ran a program that I helped them formulate and came up with a $2.1 million for the year 2000-2001. Well, I thought, well, gee whiz, $2 million, and we're cutting at doctors and nurses and technicians and staff and cutting services back on citizens. This money could be used in a better way. And I started trying to air this in front of these scope of services personnel for county. Well, they didn't want to talk about it. I just can't see cutting services to our people and continuing to provide this amount of money to undocumented or illegal aliens. $3.5 million are going to for illegal immigrants. Those are $3.5 million that our program could use to get providers to take our patients. I think Mexico and other countries are dumping the needs of their citizens onto the taxpayers of this country. That's what I think. We have patients that travel back and forth from Mexico to get medical care. Well, I don't like to be deceived by my own government, and I certainly don't like to be sold down the river by my own government. And I think that I've raised the Congress of this country asked me to bring forth fraud when our public revenues are being depleted illegally. They've asked me to do that. I did it, but I have no backing. Quite frankly, my future with the Sacramento County right now, it doesn't matter to me. This problem that our nation faces this county faces, to me, is a bigger issue than my job. I have an obligation to my country. I have an obligation to the citizens of this county, this nation, this state. I have a duty to my family. And I have a duty to myself.